Hi everybody, my name is Alyssa Arms and I'm the owner of Back in Step Physical Therapy in Centennial, Colorado. I was inspired by some conversations on Facebook today and just wanted to make a quick video to talk about low back pain, what causes it, things to know, what to do about it, how to prevent it. And I've seen tons of people with low back pain and have treated them, but have also dealt with back pain myself, so I have an appreciation for what people go through when it happens. But I just wanted to talk a little bit more about it. So low back pain, it can be from anything like you slept weird and in a bad position, you sat in a bad chair for a while, you hurt yourself while you were working out at the gym, you were catching something, misstepped. There's so many different things that can cause back pain in the first place. And sort of no matter what caused it, a lot of times some of the same concepts apply. One thing that's important to know with low back pain is once we have it going on, even for a short amount of time, like a couple of days, it can actually start to cause the shutdown of some other muscles, not only around our back and core, but even into our hips. And over time, this becomes a bigger problem. So it's important that once you do get some low back pain, that you learn what exercises and stretches you need to be doing to address whatever muscles are starting to kind of shut down a little bit and not do their job as well as they're supposed to. One other important thing to know is, a lot of people, their default is to go and get a back brace. It could be from Walgreens, it could be their doctor gives them one, whatever, but they decide that a back brace is the thing that they need and they wear it all the time. And yes, even talking from personal experience, wearing a back brace can provide some more support, especially if you have to be up and functional and it just hurts to move. But the important thing to know is if you're going to be wearing a back brace, you also need to be doing things to counteract what's happening. If you think about our body and our spine, we have all of these muscles around to help support our spine. We have core muscles, our pelvic floor, muscles and structures within the back itself. If we're providing an external support like a brace to that area, our body starts to think, maybe I don't need to be working quite as hard. And so those same muscles that might already be shutting down just because you have back pain, now we're also getting another message saying they don't need to work so hard. So ultimately what can happen when you're wearing a brace so often is your body starts to rely on that brace. You actually create a higher risk of injury for yourself if you go and do activity without your brace at that point, because your body, whether it's muscles or ligaments or whatever, isn't used to having to provide support for you anymore. So it becomes this vicious circle. Most importantly, whether it's part of recovery from a back injury or just to prevent back injury in the first place, there are a few muscles that I find tend to need some special attention. The core muscles, specifically muscles like your transverse abdominis, which I know doesn't mean a lot to most of you, but it's one of our primary stabilizer muscles within the core towards the front of our body. And some of our hip muscles, whether it's hip stabilizers like the gluteus medius, or even some of the big glute muscles like gluteus maximus. And then of course our pelvic floor. So, if you're doing Kegels or that kind of thing, all three sets of those muscles are really important to keep nice and strong to help provide some additional support for your back. They're built in there, they're meant to do that job, but so often we can function without using them properly. And then I also find that typically hamstrings and hip flexors, so things like your iliopsoas, tend to be tight on people. And so if you can keep a good muscle balance, keeping the appropriate muscle strong and the appropriate muscles stretched out, that can already help you either prevent back pain in the first place, or those are things that are important to work on during your recovery. So I know this is super quick and very basic information, but I just felt like it was really important to be able to share this with you guys and share a little bit more about what you should and shouldn't do when you do deal with back pain, because let's face it, most of us do at some point. Most of us can get through it pretty well, but if not, it's really important to go and get care as soon as possible to get you on the rec track and get you back in step, pun intended, with things in your life. So again, my name is Alyssa Arms, owner of Back and Step Physical Therapy in Centennial, Colorado. Thanks for watching.